And with flu season in full swing, health officials are asking parents not to bring their children to emergency rooms unless it's truly an emergency. There's been a spike in the number of young patients showing up with flu symptoms. Because of that, the ERs at Saint-Justine and the Montreal Children's Hospitals are overcrowded. And Maya, all this is putting a lot of pressure on the system.
It is, Paul, and that's because these ERs are seeing up to double the number of patients they normally see on a daily basis. And doctors say in most cases, these flu symptoms can be treated easily at home.
Come, let's get Santos up on the table.
This mother brought her 5-year-old to the Tiny Tots clinic in Côte Saint-Luc, concerned about a lingering cough. For her, going to the ER was out of the question.
I've been there many times before and waited for hours and hours.
And so you've decided not to go through that again?
No, I prefer coming to a clinic. Then it's more quicker and convenient.
But health officials say some parents panic over common flu symptoms and rush their children to hospital. At this time of year, that makes for crowded ERs and long wait times, frustrating for staff and for the parents of young patients with real emergencies.
He had to wait 4 hours with a broken arm.
How did you break it?
I was skiing and I fell backward.
For the past 2 weeks, Saint-Justine's and the Children's have been seeing an average of about 250 to 300 patients a day in their ERs. That's compared to a normal average of about 150 to 175. This doctor at Saint-Justine says often a simple call to Info Santé can give parents information that will answer their questions.
Big breath.
Back at Tiny Tots, Dr. Burko says some parents can be overly fearful.
There is a phenomenon of fever phobia.
Dr. Burko says a fever is generally harmless unless the child is under 3 months. There are other signs to watch for as well, such as trouble breathing.
Any child that's been throwing up or having so much diarrhea that they're not wetting a diaper every 6 or 8 hours and is just lethargic, they need to be seen immediately, and yes, in the emergency room. Any other child who's just plain old sick, especially the parents can say, I think that's a cold. They should be staying at home, period.
But for parents who insist on a checkup, there's always the family doctor, the local CLSC, or a walk-in clinic. Maya Johnson, CTV News.